Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Baby Health Checkup. Well Baby Exam. Introduction. During his or her first year, your baby should receive regular checkups from a healthcare provider. These visits are often called well baby exams. Well baby exams are important. They make sure that your baby is growing and developing properly. If there are problems, you can catch them early. This program explains what to expect during a well baby exam. It discusses information about the way your baby's health is evaluated. Tips to help you prepare for a well baby exam are also included. Baby Health Checkup. Well Baby Exam. Well baby exams usually take place 6 times during a baby's first year. A well baby exam is separate from any other visit for sickness or injury. Babies need to see a healthcare provider 2 to 3 days after coming home from the hospital. After the first visit, babies need to see the healthcare provider when they are 1 month old, 2 months old, 4 months old, 6 months old, 9 months old. At these visits, a healthcare provider can help catch problems early when they may be easier to treat. Well baby exams are needed even when your baby looks healthy and happy. These exams help monitor your baby's growth and development. If you are worried about your baby's health, don't wait until the next scheduled well baby exam. Call your baby's healthcare provider right away. Preparing for a well baby exam. You need to prepare some information for the well baby exam, including information about your baby's current health and previous medical history. Gather your baby's medical records and take them to the appointment. This includes a record of shots your baby has received and results from newborn screenings. Make a list of any important changes in your baby's life since your last healthcare provider's visit, like being sick, falling or getting injured, starting daycare or getting a new caregiver. A well baby exam is a great time to ask the healthcare provider any questions about how your baby is growing and developing, how your baby is sleeping, breastfeeding your baby, when and how to start giving your baby solid foods. You can ask your healthcare provider about the changes and behaviors you can expect from your baby in the coming months. It is also a good time to ask how you can make your home safer for a growing baby. Here are some important questions to ask. Is my baby up to date on shots? How can I make sure my baby is getting enough to eat? Is my baby at a healthy weight? Is my baby getting enough sleep? Take a notepad to each well baby exam. Write down the answers your healthcare provider gives. You can review the answers later if you forget what was said during the exam.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Measurements and exam. Your healthcare provider will likely start the exam by measuring your baby's weight, length, and head circumference. Your baby will need to be undressed during the exam. To keep your baby from getting cold during the exam, you should bring a blanket. Your baby's measurements will be added to a growth chart. The healthcare provider can show you how your baby's size compares to other babies of the same age. Do not be discouraged if your baby isn't growing as fast as other babies. It does not mean that your baby is less healthy than the babies he or she is being compared to. The most important thing is that your baby shows steady growth from one visit to the next. Your healthcare provider will also perform a head-to-toe physical examination of your baby. This is a good time to talk to the healthcare provider about any concerns you have about your baby's health. During the head-to-toe exam, the healthcare provider will check your baby's head, ears, eyes, mouth. The healthcare provider will also check your baby's skin, heart and lungs, abdomen, hips and legs, genitals. The healthcare provider may check the head for soft spots. Soft spots are a sign that your baby's brain has room to grow. The healthcare provider will check your baby's ears for fluid or infection. A complete hearing exam usually is not needed, but the healthcare provider may want to see how your baby responds to different sounds, including the sound of your voice. The healthcare provider will examine your baby's eyes. He or she will check for eye discharge and blocked tear ducts. During later visits, the healthcare provider will track your baby's eye movements using a bright object like a flashlight. An oral exam is part of the head-to-toe checkup. The healthcare provider will check your baby's mouth for signs of oral thrush and teething. Oral thrush is a common, easily treated yeast infection. The healthcare provider will check your baby's skin for rashes or signs of jaundice during the exam. Jaundice is when the skin and the whites of the eyes become yellow, urine darkens, and the color of stools becomes light. It is a common, treatable condition in newborns. Your baby's heart and lungs will be checked during the physical exam. The healthcare provider will use a stethoscope to listen for abnormal heart sounds or breathing problems. The healthcare provider will also check your baby's abdomen for tenderness or enlarged organs. This is done by gently pressing the abdomen. Your baby's hips and legs will be checked during the head-to-toe examination. The healthcare provider will move your baby's legs to detect any problems with the hip joints. The healthcare provider will also examine your baby's genitals to make sure there are no signs of infection, lumps, or tenderness. If you have a girl, you may be asked about vaginal discharge. Boys will be checked to make sure their testes are developing properly. Immunization shots. A well baby exam also includes getting shots. These shots protect children from serious diseases. They are sometimes called vaccinations or immunizations. Shots work best when children get them at certain ages. Healthcare providers follow a schedule of shots that begins at birth. Ask your healthcare provider for a list of your child's shots. This is known as a shot record. Keep this list in a safe place. You may need it for school and other activities. Remember, your child needs all recommended shots to be protected. Each vaccine protects your child from a different disease. For instance, the polio vaccine protects the baby from getting infected with the polio virus. Polio infections can cause the child to be paralyzed and unable to walk for life. Vaccines are tested for years before they are put into use. The risk of harm from these shots is small. Side effects from shots are usually mild and last only a short time. Some children have no side effects at all. Ask your healthcare provider what to expect after your child's shots. Baby growth and development. During a well baby exam, your baby's healthcare provider can help you identify the signs to look for in your child at different ages. These signs are called developmental milestones. Healthcare providers look for specific developmental milestones at each visit. Each baby grows and develops differently. By their first month of life, most babies are gaining weight, have a good sucking reflex, react to sounds, move arms and legs. By their second month, most babies lift their heads when lying on their stomach, look at close objects, make cooing noises, smile, have different cries for different feelings. By their fourth month, most babies roll over from front to back, try to reach and grab objects, put objects in their mouth. By their fourth month, most babies also start babbling, laugh, recognize a parent's voice or touch. By their sixth month, most babies move objects from one hand to the other, roll over from back to front, start teething, sleep for 6 to 8 hours a night without waking. By their sixth month, most babies also copy people's actions and sounds, become scared of strangers, like hearing their own voice. By their 9th month, most babies crawl, sit for long periods of time without support, feed themselves with their fingers, throw and shake toys. By their 9th month, most babies also understand the meaning of no, respond to their name, wave goodbye, play games like peekaboo. Some babies reach certain milestones sooner or later than other babies. What's important is that your baby shows steady growth from one visit to the next. Your healthcare provider will let you know if you should be concerned about a delay in your baby's development.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Well baby exams usually take place 6 times during a baby's first year. A well baby exam is separate from any other visit for sickness or injury. At these visits, a healthcare provider can help catch problems early when they may be easier to treat. If you are worried about your baby's health, don't wait until the next scheduled well baby exam. Call your baby's healthcare provider right away. You need to prepare some information for the well baby exam, including information about your baby's current health and previous medical history. Gather your baby's medical records and take them to the appointment. This includes a record of shots your baby has received and results from newborn screenings. You can ask the healthcare provider about the changes and behaviors you can expect from your baby in the coming months. It is also a good time to ask how you can make your home safer for a growing baby. Your healthcare provider will likely start the exam by measuring your baby's weight, length, and head circumference. Your healthcare provider will also perform a head-to-toe physical examination of your baby. A well baby exam also includes getting shots. These shots protect children from serious diseases. They are sometimes called vaccinations or immunizations. Shots work best when children get them at certain ages. Healthcare providers follow a schedule of shots that begins at birth. During a well baby exam, your baby's healthcare provider can help you identify the signs to look for in your child at different ages. These signs are called developmental milestones. Healthcare providers look for specific developmental milestones at each visit. Each baby grows and develops differently.
Thank you for using Explain.